Ted Barnett, the founder and president of Rochester Lifestyle Medicine Institute. And it's so great to have everybody here for our monthly grand rounds. So all of our CMEs are free, including Jumpstarting Health for clinicians are also free. And they also include those two programs, Jumpstarting Health and the LIFT project, include live interaction with participants, with either patients or other physicians on our Zoom calls. Tonight, our guest panelist is Dr. Ron Weiss, who is dual certified in internal medicine and lifestyle medicine and is a primary care physician serving as executive director of Ethos Primary Care and also as assistant professor of clinical medicine at Rutgers, New Jersey Medical School. And Dr. Weiss is not only a physician, but also a botanist and farmer, and he offers an evidence-based food as medicine approach to healing from chronic illness and optimizing wellness. He has been featured in top media, including the New York Times, the New York Post, the Today Show, New Jersey Monthly, and the feature-length documentary, Eating You Alive. One of our regular panelists, Dr. Bob Breakey, is board certified in family medicine and lifestyle medicine. He's been a family physician in Ann Arbor for 36 years and serves as the medical director for IHA's William J. Folletti Institute of Lifestyle Medicine and also the chair of IHA's governing board. He's also on the board of directors for two national organizations, PBNSG, or Plant-Based Nutrition Support Group, and PPOD, the Plant-Based Prevention of Disease, which runs several wonderful national conferences. Dr. Sundermann is also one of our regular panelists, and she's board certified in internal medicine and lifestyle medicine. She's been practicing medicine for over 20 years and is currently at IHA East Brighton Primary Care. She has training in integrative medicine and completed a professional training program in mind-body medicine and is a member of Academy for Eating Disorders. Her clinical interests include lifestyle medicine, plant-based nutrition, food as medicine, and sports nutrition. She is also an avid endurance athlete and is outdoors as often as possible, which if you follow her on Facebook, you'll grow green with envy. She's always out there. Dr. Julie Yoon is our presenter tonight. We're so grateful. She's the one actually doing all the heavy lifting and the hard work because she has prepared a case for us. She's board certified in internal medicine and lifestyle medicine. Her 15-year career started in geriatrics, and currently she has a private practice at the Internal Medicine of Brighton practice. She received her undergraduate in biology from Cornell, a Master of Science degree in microbiology from Washington State University, and her MD from Upstate Medical University, internship and residency program at the University of Rochester, and a fellowship program in geriatrics, also at the U of R. Dr. Susan Friedman is our Director of Clinical Studies at RLMI and is board certified in internal medicine and lifestyle medicine. She acts as our Director of Clinical, I already mentioned that. She's a professor of medicine. Sorry, I'm jumping around here. Anyway, she and I show up all the time for these. I'm not going to go through my own here because we want to get to the case. So let me move on here. Our case tonight is LM intervention leads to remission of type 2 diabetes, but persistent hyperlipidemia. And our presenter is Dr. Julie Yoon.
Well, thank you so much. Thanks for that intro. And I want to thank you for this opportunity to present one of my most interesting patients to you all. It's an honor to be presenting to you all. I know there's some real heavy hitters out there. All of my patients are very special to me, but today's patient in particular is quite special for a few reasons. The first reason is that I feel that he provides us with an excellent example of the power of some of the most simplest lifestyle changes that can have a huge impact on one of the most time-consuming, expensive, and devastating diseases that we deal with today. Second of all, I admire his dedication and his perseverance to improve his health, which he's demonstrated consistently over the past 4 years that we've known each other and that we've been working together. Third, he's very special to me because he expresses his extreme gratitude to the Barnetts and to the Lifestyle Medicine Group for all that you guys have done and the work that you do to help people just like him who are looking for some other treatment besides just drugs, pills. And he always expresses such gratitude to me and to my staff. I wanted to read to you this card that he just sent me. He always sends me cards, at least on a monthly basis. And this just came a couple of days ago. I'll read it to you. It says, "Dear Dr. Yoon, thank you very much for helping me with my prescriptions. I am grateful. Have a nice day." Now, if all of my patients sent that to me, I'd be walking on cloud nine all the time. So the story began for me actually a couple of chapters into the novel. So when I met Chad, we'll call him Chad, he had already been diagnosed with diabetes. He completed the Jumpstart program and essentially reversed his diabetes entirely. Ted Barnett then contacted me, asking me to accept Chad, who was in need of a provider who is fully supportive and knowledgeable about plant-based diets, as well as the importance of lifestyle changes to promote great health. So since I picked up the book about halfway through, I had to kind of look back through his records to prepare for this presentation, and I had to ask Chad to fill in some of the blanks here. So what I wanted to do is to present to you in the first part of the talk. I wanted to just chat about his diabetes diagnosis, and after that we can just pause to discuss. Anybody can chime in, comment. And then in the second half, I wanted to talk to you about the struggles that we've had with his cholesterol. And I seek from all of you some insight into where you all would go from here. So when I met Chad, he was 60. And he landed on the map when he presented to urgent care in September of 2018. And his chief complaints at that time were blurry vision, in addition to like probably some acute on chronic low back pain, in the backdrop of chronic depression, PTSD, general anxiety. So at urgent care, he reported that a couple of months prior, he was in a car accident. He was actually just a third vehicle bystander in what was essentially just a two-car collision. And so he didn't really sustain any injuries, nothing where he actually had to seek any medical care. He didn't have any need for any medical attention at that time. So he turned up to urgent care because I guess in the 2 months he had felt that maybe his anxiety and depression had been acutely exacerbated by that car accident.
The
So
slides are advancing.
when he presented to urgent care, his blood pressure was elevated.
Oh, Julie, are you trying to advance your slides?
Yes.
Okay, thank you.
So sorry about that. His blood pressure was elevated, his weight 203 pounds. And a point of care blood sugar test showed that his BG was 209. So a little bit more background. He has a long history of depression, some anxiety, PTSD, lumbar disc and cervical disc disease, and post-laminectomy syndrome, for which he has chronic pain. His only surgeries were really a cervical and lumbar spine hemilaminectomies. And looking back in his records, really that's all that I could find is just a lot of neurosurgery notes with not a lot of other ancillary information, at least not any significant primary care. So he's married, he's a disabled school teacher, a never smoker, and his medications included a bunch of chronic stable medications prescribed by his psychiatrist, which he had been on for probably a decade or more. So with this urgent care visit, there were really no significant findings, and aside from the blood sugar of 209, and he was prompted and urged to follow up with a primary care doc. So in pretty short order, actually, he was set up with a new PCP, and he was seen in September, on September 11th, by a PA for a chief complaint of elevated blood sugar, as well as that recent MBA, but again, no injuries. After that visit, hemoglobin A1C was performed, and it was elevated at 13.6%. And in the blink of an eye, he was plugged into the standard of care diabetes management machinery and instructed to begin metformin and Lantus. 3 days later, actually, he met quickly with a diabetes educator and was taught the proper administration of Lantus and the importance of metformin. And of course, no diabetes teaching session is complete without discussing carbohydrates, insulin, carbohydrate counting, plate portions, half veg, quarter protein, quarter starch, and of course, a discussion of all the potential side effects of these medications, such as GI upset, diarrhea, hypoglycemia. So from this time spent, education, coordination of care, counseling, 80 minutes. So just so you know, if this patient right out of the gate ended up in my office, if I were presented with this patient who just popped onto the primary care scene with really no evidence of having received any maintenance primary care, and someone with an A1C of this magnitude, admittedly, I probably would have done the exact same thing. Some metformin, insulin, as well as education. Fortunately for Chad, he had heard about the Lifestyle Medicine Institute. He visited the office and was intercepted by Dr. Barnett, who suggested a different type of drug. So in September, in that same month, Dr. Barnett urged him to sign up for the Jumpstart program, which was ongoing, and he joined in and he was totally hooked. 1 month following his original presentation to his new primary care doc office, he actually met with the physician on October 5th. He admitted to the doctor that he actually had not started any of the medications, and the doctor expressed a great deal of concern, dismay, and probably a lot of bit of anger. And in Chad's words, right? So the doctor claimed, and this was actually garnered from the note, not to be a the doctor claimed to be a westernized medical practitioner and not a believer in homeopathic remedies for the treatment of this patient's diabetes. So then Chad was instructed to continue to work with his naturopath and to repeat blood work in 2 months. So this is actually when Ted approached me, and I gladly accepted this gift, which was too good to be true. I saw Chad in my office 3 months after his original diabetes diagnosis, and pretty much 3 months to the day, his A1C was repeated, and it had improved from 13.6% down to 6%. His weight also was down in 3 months by 18 pounds. His diabetes had pretty much been diagnosed, treated, and cured. So I met him at the office visit. We had a really nice chat. He told me all about what had happened to him in the past few months. And so in order to feel or appear as if I were putting some effort into rolling this ball down the hill, I told him, well, why don't you repeat the A1C and come back in 3 months and we will go from there. And so 3 months later, even better, 5.6%. So that basically took me up until the time I met him, and I thought we would pause here to take any comments or questions.
Still no medication at this point.
Still no medications at all, no.
Did he continue his other previous ones or just?
Oh, his psychiatry, psych medications, he did continue all of those.
Okay.
Those were
Thanks.
some chronic stable medications, yes.
No new meds, yeah, thank you.
No.
Dr. Yoon, how tall is the patient?
Oh, if I had to guess, about 5'10", 5'11".
You're muted, Melissa. Melissa, you're muted.
I was just asking, do we have a BMI on him, Dr. Yoon?
Oh, golly. Do.
Well, if he's about 5'10" or 5'11", and at his new weight of 185, he'd probably be just mildly overweight.
Yeah.
But probably
Right, so I
about
have
26, 27.
At the time that we first met, his, so I was wrong. So he's 5'9", and weight that time 185 with a BMI of 27.
Dr. Yoon, can you comment on his previous lifestyle prior to Jumpstart? Was he a standard American diet or already leaning this direction?
Pretty much a standard American diet leading up to this.
Thank you.
And after doing Jumpstart, had he transitioned to a completely whole food, plant-based dietary pattern?
Absolutely. So when he took the Jumpstart program, he ran with the ball and turned totally vegan. And so that will address a little bit in the next part, but you know, everybody's version of vegan is a little bit different. But yes, he totally gave up all animal products.
And then any commentary on the other pillars of lifestyle medicine? I'm just kind of curious about the PTSD. Doesn't seem like that was the MVA accident that caused that. It seems something that was prior to that. And, you know, exercise and sleep and stress. You said that he's disabled. So any, can you touch on those other pillars?
So we do touch on these things, and I'd have to say these are probably some of his biggest challenges. His depression, anxiety, PTSD dates back a long time, actually to some childhood trauma. And so he struggles quite a bit with in all of these domains, and honestly does not really participate significantly in exercise. So the reason for his disability, my understanding is some kind of trauma that happened when he was teaching, was attacked by a student. And so since that time, he couldn't return. But my impression is that his long history, childhood trauma of some abuse combined with his more recent adult events probably just triggered the disability. So we don't usually touch too much on that because he does see a therapist on a regular basis as well as a psychiatrist, and he has for over a decade. But yes, and that's a very good point in terms of some of these other pillars such as exercise. He hasn't really pursued that to any significant degree. And my feeling is that he's just so challenged in other domains that that it's difficult for him.
Dr. Weiss, you have a comment?
I wanted to ask a follow-up question regarding his lower back issues. At this point, I know he has a history of a lot of, these laminectomies and chronic pain. Is his back pain persistent and disabling? And does that prevent him from exercising?
Yes, exactly. It is pretty persistent and disabling. He does see the pain clinic on a regular basis and intermittently for some steroid injections. And this is one of the things that I was looking for when I went back in his records to see if it was like a chronic use of some steroids that may have triggered some of his diabetes, but it was kind of spotty, wasn't quite clear to me.
So has he ever, just one more question, has anything been done other than chronic pain management? Any rehabilitation, any definitive rehabilitation, or perhaps other sort of outside of the box kind of modalities to address his lower back pain? Things like a Goscue method or any other kinds of methods that he could take advantage of for his back pain?
Actually, no, I don't believe so. Outside of the traditional physical therapy, no, actually, I don't think so. That's a good point.
And then his psych medications, he was on quite a few and in pretty high levels of Seroquel. Looks like 50 TID and then an additional 100 to 150 QHS. And was there any attempt in just a lifestyle medicine approach with his psychiatrist? Is that just kind of, he needs to be on those drugs, we're not going to really go there? Just knowing that the Seroquel could, have some effects on probably body weight and cholesterol and possibly blood sugar.
This has always been my thought is, what role do all of these psychiatry medications have in his overall metabolism, his liver, but I have never really touched on these because for some other medical reasons, he has had some acute exacerbations of anxiety, depression, PTSD that has led me to just never really go there and tread on that psychiatrist's medications. So, and another thing that I admire about him is that he's just so challenged from a psychosocial and psychiatric standpoint that he's still able to really work hard at maintaining his good blood sugars.
And then one last question. So he's disabled and he's 60, so relatively young. I can say that when I'm in my 50s, he's a young guy. So what kind of things does he like to do? What's his sense of purpose, or how does he fill his days? What brings him joy? That kind of context.
I think his family mostly. I actually do take care of his wife as well. And she has had some health challenges of her own. And so I think the two of them together have really worked hard on trying to make some lifestyle medicine changes. The exercises they probably limit themselves to are going for walks, but they do enjoy their time together.
I think an interesting thing for me about this case is that it came on with him already so far out of control. And I think that can happen fairly suddenly. You mentioned you had a little blurry vision, and of course that can just be the hyperglycemia, but you haven't mentioned any neuropathy or renal manifestations. Maybe you're coming to that. But if it had been long-term, you'd expect he might be starting to get some secondary complications. The one that comes out though is the low back and the degenerative disc disease, which I was at an ICNM conference 4 years ago, and the presentation with respect to that being a vascular disease. And Dr. Greger has a good video on this. I'll post in the chat.
Bob, you're muted.
You muted yourself, Bob.
Oh, I'm sorry. I'm talking away here. Thank you. Was I muted that whole time?
No, we heard you talk about Dr. Greger.
Okay. I'll post in the chat his video on back and circulation, and how because of vascular deprivation to the largest avascular tissues in the body, that it leads to that. So that could be a complication from some prediabetes that he may have had earlier on, or just vascular disease from the standard American diet. But interesting that it resolved so quickly too. I mean, standard teaching is with an A1C and a glucose that high, you automatically better start insulin, as you mentioned, Dr. Yoon, that you need it, but he did it without. That's a power of the lifestyle change to make a relatively quick reversal. So that's great.
The piece that I found so frustrating in doing a little bit of the research on this is when I went back in his records, there were just a lot of neurosurgery notes in there from his various surgeries, but I couldn't find a significant amount of blood work to see what was his kidney function or what were his fasting or non-fasting blood sugars. It was just totally absent. With respect to the other complications of diabetes, he actually did see, right after he was diagnosed with that A1C of 13.6, he actually did go quickly thereafter to an ophthalmologist and had a normal exam, so there was no evidence of diabetic retinopathy. And he has no evidence of peripheral neuropathy, and his renal function is totally normal, has always been. So I think that is probably something that is the case that in relatively short order, it just somehow his maybe blood sugars just exploded, and maybe it was some manifestation of the recent car accident or something, because of course, now knowing him for 4 years, I do feel that when he does have these exacerbations of his anxiety and PTSD and depression, he probably does decline from an intake standpoint, like his lifestyle changes tend to regress a little bit.
With these changes that he made of going from a standard American diet to a whole food plant-based gut microbiome nurturing dietary pattern, losing weight, did he state that he felt better? Was he aware of that? And we know the 90% of the serotonin receptors in the gut microbiome. Was he aware of any improvements in his mood, his physical, his pain levels, anything like that?
Oh, that's a great question. I don't know if I can answer that. I mean, he did definitely feel better, but I don't know if it was a manifestation of just the total dietary changes or the fact that, he just always is just so grateful for the level of care and attention that he receives now.
Dr. Yoon, why don't you move on to the rest of the case, and then we can open this up for discussion again. Would that be?
Yeah, sure.
We can definitely come back to these points. I've got a bunch of questions myself, but.
Okay. So in the next half, this is the part that he and I just continue to struggle with. And I ask you all for some advice, but this is what happened. So then in December, he came to me prepackaged, and he also had his fasting lipids done. His total cholesterol 203, triglycerides 132 with an LDL of 140. Historically, he had mentioned, and this was just mentioned in some previous notes, but I didn't see any numbers, that he had been told before that his numbers were quite high. Just so you know, the EPIC system has me trained to look from right to left. So the oldest blood work is on the right and the newest is on the left. So in December, those were the numbers. And then I don't know what I did, but maybe I broke him or something. But I said, well, you know what? Why don't you just continue what you're doing? It sounds like you're doing awesome. Let's come back, and in March, let's repeat your A1C and then repeat that fasting lipid profile. So he came back to me in March 2019, and his total cholesterol jumped to 238, largely in part due to a huge rise in his LDL cholesterol. And his triglycerides actually looked still pretty good. So my next step in dealing with this is we did some label reading. And I know you all know this stuff, but I just thought I would put it here for people not as familiar. We went back to the Esselstyn rules. And so he was somewhat familiar with this because he did do the jumpstart. And so I recapped for him, in order to lower LDL cholesterol, I said that we should try and focus on reducing overall consumption of fat calories. So as you know, to calculate that, the percentage of calories from fat in foods, you take the total calories from fat per serving, divide that by the total calories per serving, and then multiply by 100. So I always like to pick on cheese, but this doesn't have to be dairy cheese. This could be vegan cheese as well. So here we have a fat calorie count of 80 divided by 110 multiplied by 100 gives us 73% of the calories from this food are all fat calories. So this is a high fat food. In my office, I have all these other props and examples. We go through various examples of different food labels, whether it's fats, potato chips, cereal, and then also I bring out the vegetables and we compare and contrast the amount of fat calories and even vegetables. So he took the ball, ran with it. And so again, from right to left, when I saw him again in March, his LDL cholesterol 174, he implemented those Esselstyn rules. And lo and behold, his LDL cholesterol came down to 109. He, at this visit, brought in pictures and food packages, and he even brought the food in, and he showed me what he was eating tons of oatmeal, apples, blueberries. Like he even brought in a bowl, which he said that he put all the salad in, was just this huge salad bowl. He was making food at home, and he definitely wasn't adding any oils. What he removed from his diet, he said after learning how to read labels, he didn't realize that the nuts and the seeds, especially those that were in these nutrition bars that he was eating like 2 or 3 a day, was contributing to his elevated cholesterol. He was eating a lot of granola cereal, and he took all of these things out of his diet. What I've oftentimes seen with people who make this huge change is what we see here, where his triglycerides also jumped to 406, and that I see quite a bit when people do the Jumpstart, make these huge changes. The LDL certainly does come down in the vast majority of cases, but the triglycerides go up. So again here, going right to left, June is right after he implemented those Esselstyn rules. And we continued to check throughout 2019, 2020, 2021. I left out a whole bunch in the middle on purpose just because I didn't want to mess up the screen with all the numbers, but he was super involved and dedicated to trying to get these numbers to be better. Now, by the end of October, because the numbers were still kind of high, I urged him, why don't you repeat the Jumpstart program? Because the first time around, he really hyper-focused on the carbohydrates and the sugars. And so he did in fact do it because he's just really good that way. He tries his best to do everything that I recommend. So he repeated the Jumpstart program. And again, his LDL numbers improved, but the triglycerides went up. My personal feeling, and I asked other people their opinion, my personal feeling is, I mean, I don't know if it's all cases, but his case, I think it's really because the intake of fruits significantly increases. And so that is probably what, at least in his case, contributes to the elevated triglycerides. So I left out all of 2020 because for this man, 2020 was a very bad year for him. He was distracted either by COVID or by his prostate problems. And as an aside, I'm a huge fan of Dr. McDougall, and I've heard him call this in the past disease mongering. And unfortunately, I feel that this has been the case for this patient, that he had a slightly elevated prostate, his prostate specific antigen, and the specialist just ran with it. And so this totally distracted him, I think, for most of 2020 and the workup of this, which fortunately for him never actually ended up in a diagnosis of prostate cancer, but it really set him off from a PTSD, anxiety, depression standpoint. So going forward to 2021, I see that his LDL cholesterol has really kind of skyrocketed. And when it in October of 2021 got to 201, I just said, you know what, maybe what we should do is do a little risk stratification. And so I recommended that he see a cardiologist. And the cardiologist I like to refer to is someone who is also a proponent of lifestyle medicine changes. And by the way, his hemoglobin A1C throughout this whole process still remained very low. So throughout all the prostate issues that he dealt with and his exacerbation of his other issues, the anxiety, depression, PTSD, he and I kind of got away from talking about lifestyle medicine changes and diet and stuff like this. So this was actually a really good reset for the both of us. During the cardiology consultation, she actually did her best to go through and have him do like a food recollection log. So still eating lots of oatmeal, lunch, salad, but interestingly enough, using large quantities of vegan salad dressing, eating lots of vegetables, not using oil, but interestingly, and I didn't know this, eats out pretty typically once a week at vegan restaurants. And just because it's vegan doesn't necessarily mean it's healthy, nor is it ever really low fat. Since he had that LDL cholesterol of 200 and I referred him to cardiology, by the time he saw the cardiologist, he gave up a lot of his fruits, and he never really did juices or sodas. But of course, he wasn't really doing any exercise as well at this point. The recommendations by the cardiologist were to do a coronary artery calcium score, high sensitivity CRP, and a lipoprotein A. He did go ahead and do this. The coronary artery calcium score was 44, I guess, Simpson units. I did not find a high sensitivity CRP in the records, but his lipoprotein A was normal at less than 6. So again, going back to this, and I guess how I feel at this point is that, my personal feeling is that the holy grail seems to be for good cardiac risk reduction, that LDL has to be as low as possible, 80, 70 or less. And so I sometimes question myself and wonder, am I really doing people a disservice, people like Chad a disservice by really trying to get him to achieve this? And is a statin ever really an answer, in order to help a person to achieve this? And I would imagine with this group, the answer is no. And I have never even really suggested this for him. Or do I accept the status quo? And so this is the question that I kind of put out there, is with all of these checks and all of the effort and all the discussions and everything that I've put him through, what next? And so this is the last A1C that I had on him from December of last year. And so
Did you want
your advice?
Did you want to show the A1C? We don't see that.
Oh, the A1C?
You said you had the last one. Oh, that's
There, the lower left-hand
the last one.
corner.
Okay,
In
got it.
December
Okay.
of 2021, his repeat
Right, okay.
A1C was excellent at 5.5.
And I'm sorry, Dr. Yoon, what was the cardiac CRP?
Oh. His coronary artery calcium score.
The high sensitivity C-reactive
Oh,
protein?
I couldn't find that. I couldn't find that in the chart.
So I'd like to give Dr. Weiss, our guest panelist, an opportunity to weigh in on this case. What are your thoughts in general, Dr. Weiss?
Oh, well, it's a delicious case because, it is so representative of many of the patients we see in lifestyle medicine. We are, to me, it's redolent of all of the reasons why I see patients every day. You see these patients who are very grateful and they're very engaged. Not everyone is, but certainly this gentleman seems to be. And then, they're doing the best they can, but sometimes they just can't quite get to the finish line. And the goals of where they really should be. So with this gentleman, what strikes me is primarily is his psychiatric history and his condition. And he has such a significant history, and he is on such powerful psych medications that if I would be moved or try to do anything in my power to try to engage him on a level through lifestyle intervention to taper off these medications and get him to be in a better psychological and emotional state. Because I think these medications have such side effects and have such a presence of overtaking and controlling his mentality and emotions and his desires that I'm not sure that he can ultimately get to the highest point of lifestyle medicine on these medications. They're controlling him. Now, the question is, would he be open to another way? And that I don't know, but I would try to do everything I could to broach this subject with him. And of course, when I have patients like this, who have trauma, I usually start to introduce them to a film which is called The Wisdom of Trauma, which was produced by a Canadian medical doctor, actually, whose life's work is on trauma that stems from childhood, like dysfunction. And then certainly mindfulness-based stress reduction, if he is open to it, I think could be key for him. And there are even other modalities such as Pia Melody, who is an RN who opened up a center in California. Her life's work revolves around the family of origin and dysfunction of upbringing in a family, which leads to trauma. And she has unique methods, which I have witnessed, which are very powerful to help really change people's trauma and their feelings about it. So I think that really diving, if he allows it, of course, he has to be open to this and he has to want to do it. But if he does, I think I would try to address the psych, and I'm getting to the cholesterol. I'm telling you why this is going to be important for the cholesterol, but we need to address that head on. I believe that is more of a danger to his health than the cholesterol is. So this is why that's important. We have to engage him enough to battle his physical pains. And when somebody is mentally overwhelmed or under the influence of these powerful medications, it's hard for them to, I believe, to engage physically at the levels necessary to, for example, help his chronic lower back pain or lose another 20 to 40 pounds, which he should do. I'm assuming he's still 185 pounds or so. So he would, weight loss is the most, in my book, is the most powerful lowerer of LDL cholesterol, especially once you have somebody who's eating a basically good whole food plant-based diet. If we got him to be at the optimal BMI, and I'm not saying we can do that, which would be between, let's say 21 or 22, that would be a 40-pound weight loss that he still has yet to go. I am sure by looking at his last cholesterol, which was 138, he would definitely be normal, probably an LDL approaching 70 or 80, and then you wouldn't have to worry about the statin agent. It would be a non-issue. Mm-hmm. The other issue is, the back pain. So, and I just want to getting back to my personal experience with getting people off the psych medications who've been on for decades, similar medications. The majority of the lifestyle medicine patients I encounter, once they're successful with the food, like he's made a major achievement with erasing his diabetes, they're usually open to getting off the other medications and getting off the psych. The last thing I wanted to say was the back pain. We need him to have movement nutrition, and not just exercise, which will help his loss of weight, which will then help his LDL. But if he feels so terrible, he's never going to want to, it's going to be too painful for him to move. So aside from the standard physical therapy, which it sounds like he may have partaken of, I don't feel that just chronic pain management, if that's what he's up to at this point, I'm not sure that that's going to bring him further down the track of being able to exercise and lose weight and actually feel better, and increase his endorphins so that emotionally he's better, so he can decrease his antidepressants and anti-anxiety medicine. So oftentimes I will use, and I alluded to this before, sort of out of the box kinds of approaches for low back pain. Of course, some of these tools include Dr. John Sarno. So this patient seems like, he has a lot of psychological stress, and that may be playing a significant role in his back pain, a la Dr. Sarno, who wrote, the famous back pain book. The Egoscue method, which takes an approach of addressing his mechanics symmetrically, using a symmetry a construct. It's a different kind of movement engagement that I often find works well where standard physical therapy never helped anyone. And the last suggestion I would have is there's kind of a newer movement in the country of exercise and physical therapy, which is called MoveNat, or natural movements. And you can find out more about them at movenat.com. There are physical therapists who are trained in these natural movements. And basically what it does is it incorporates natural everyday movements into a patient's life that can really get rid of posterior chain stiffness and inflexibility, and actually get him to start feeling better for basic things that he's doing around the house. So I think if we put all these things together, we can lose the weight and we don't have to worry about the statin agent.
Thanks.
Wow.
Those are fantastic suggestions.
So Dr. Yoon, thank you for presenting an incredibly interesting case. And it's obviously someone that I am familiar with, although I haven't seen him in a while. And Dr. Weiss, thank you so much for your insights. And I'd also like to thank our other panelists, Dr. Breakey and Dr. Sundermann. We have a couple of minutes to open this up to anybody on the floor. Although there is, here's a question that somebody put in the chat. These are this is regarding his hemoglobin A1C. These are spectacular changes. What's a typical range of A1C decrease and weight loss, and in what time frame? So how quickly can we expect things like that to happen? Dr. Breakey? Or Dr. Weiss, you look like you're about to answer it.
No, I'm sorry. I was just reading I was just reading the chat because someone was asking for some. Oh, good. Yes,
Okay.
Egoscue.com, MoveNat. If you go to Pia Melody, you can search her. You can find about her center. It's in California, the Meadows. But there are practitioners who use her techniques. And of course, MBSR, I think we're probably all familiar with that, with John Kabat-Zinn. So I'm sorry, I wasn't going, I was just trying
okay.
to.
That's okay. Dr. Breakey, how often, how quickly do we see those?
Clearly this one's on the excellent results, and there's a range in my experience. I've had one similar though. He had been A1C at 12 for over a year, and on a whole food plant-based diet within 4 months was down to 5.7. So we do see this. It can change that quickly by correcting the deficit, by allowing the body to go into healing mode. I'd say much more commonly, though, it's more gradual. And I know Dr. McDougall had his hand up. He's seen thousands of patients through his program. Dr. McDougall, do you have a comment on what range of experience on how fast you see diabetes reversal and how often?
Well, usually in 3 or 4 days, I have to take them off all their medications.
Yeah.
They're type 2 diabetic, and if you don't, then you face hypoglycemia. So you got to be prepared for really rapid blood sugars. I've taken people off 140 units of insulin who are type 2, and of course, I'm sure they're type 2. So it happens quite quickly. And of course, as time goes on, weight loss adds a lot to that. I had a question for Dr. Weiss, though. Is, you were listing, you obviously know quite a bit about these psychiatric medications, and most of us don't. And I'd like to know how you go about getting people off medications such as benzodiazepams, which have, a serious withdrawal issue with them. And, usually even when I see people at the clinic, I'm usually afraid to adjust their medications, even though I know they need to get off of them. And, a few wise words from you on how to do it or not to do it or what to do would be appreciated.
Sure, of course. Well, before I answer that, I just want to say, Dr. McDougall, I stand upon your shoulders.
All right, thanks.
Thank you. You probably may not remember me, but I met you when I was first starting off, and I came to visit you at the advanced study the weekend. And thank you for mentoring me. So the first approach I take when people are on these heavy psych meds, and then if I have time, I'll give you a tiny little anecdote of a psychiatrist, which I think is apropos our conversation. I actually saw as a patient a few months ago, if we have a couple of minutes. But the first thing I do is I need buy-in from the patient. The patient has to want to initiate it. I may make some suggestions and may lead the patient or ask from a coaching position how they feel about this, or what would they think about maybe reducing some of the medicines. But it's sort of more of I do not take the lead in suggesting they should reduce their medicines, because they have to be driven to do this. They have to have a certain sense of confidence that they want to do it and they will succeed. And once I get that signal from them, if they're in agreement, I start to taper it very gradually. And of course, the other thing I do, which I am certain to do, especially when someone has been heavily medicated by a specialist, for example, in this case, a psychiatrist, is I don't do this myself, because I don't want to anger this psychiatrist who has been taking care of this patient for many years with these drugs. So I encourage the patient, and this almost always works out, to go to the psychiatrist and say, listen, I fixed my lifestyle, I'm exercising, I feel better. Can we please, I want to taper down the medicines a little bit. And 95% of the time, the psychiatrist will be on board and they will slowly start the tapering process. And then I pitch in and I move the patient along. And we have many patients who have been for decades on Seroquel and all these other kinds of drugs. Of course, they have to be exercising. They have to be doing MBSR. They have to be doing the food. And they're fine decades on these drugs. And then we have them years off of the medicines and they're fine, stable, and asymptomatic.
Well, I've had a little experience with the benzodiazepams, and and I think the scientific literature is coming up to speed with my experience, and that is you can get into huge trouble trying to get people off drugs like Xanax. And I certainly am very cautious when I deal with this class of medications. And I know what you're saying in terms of let the psychiatrist do it, because
absolutely. And I do see psychiatrists, they're careful. The psychiatrists do taper people off of benzodiazepines, but it's a slow process. The other thing I just wanted to say is just a nice little thing is I saw in urgent care a couple of months ago, I saw a 90-year-old psychiatrist who was still actively practicing. And I didn't know he was a doctor, but it was a Sunday afternoon and he was sitting there with a little bow tie and a button-down shirt. And I said, oh, this guy is not a regular guy. I asked him what he did for a living. He said, I'm a physician. I said, what kind of physician? He said, psychiatrist. And I started to talk to him. And he's 90 years old. He still has a small practice. And historically, it was so amazing because he did his training before the onset of the antipsychotics and the anxiolytics and the antidepressants, right? He was still training in the early 50s. And he was trained with analysis, Freudian analysis. And I said, after talking to him for a few minutes, he spent his life, most of his professional life, right, since the 1960s, 70s, 80s, 90s, he's still practicing, prescribing drugs, drugging people over and over again. And I said, Dr. So-and-so, before you leave, can you impart any words of wisdom to me about psychiatry and the use of medication? He looked me in the eye, he said, Dr. Weiss, I have to tell you, at the age of 90, after treating patients and talking to them in the 1950s, medicating them and drugging them for the last 40 years, I have to tell you something. The drugs don't work. He said for most of them, it's better to talk to people and not drug them.
Mm-hmm. Yeah, thank you for that. Dr. Yoon, could you please unshare your screen? It's okay.
There's a good book on that, Lost Connections, where it really kind of reviews the fact that most psychiatric illnesses are more about connectiveness, lifestyle issues than medications.
And I was just going to say, Dr. Rice, thank you for all of those poignant points. And Dr. McDougall, thank you. We're privileged to have you on here tonight. So I think that I love it how Sarai Stanzik describes our pillars of lifestyle medicine as a wheel, and the spoke, and all the pillars are the spokes on the wheel. And I think that this patient Chad has done a wonderful job with the nutrition spoke, right? And has formulated in his mind and probably been told, you can't exercise, so we can't really, that spokes could be small. And then the sort of mental health spoke, well, you've got to take these medications. And I like how Dr. Weiss, you frame the exercise as movement, and I'm a big proponent of that, because I think that when we think about exercise, it connotates gym and doing vigorous activity, where movement, like you said, that he can walk. And are there other modalities of movement, getting in a pool and doing water exercises, be like Dr. Barnett and go bird watching. I'm also a big proponent, and colleagues on here know that about fresh air and nature, and just being outdoors, particularly if we can move outdoors, but just being outdoors, how that will lower our salivary cortisol and amylase levels, lower our heart rate, blood pressure. Studies now showing in optimizing our gut microbiome. So I think in Chad's case, paying attention to all those other pillars. You mentioned that his wife is also chronically ill. So there's probably just this narrative for both of them that they have some chronic illness. And just like our other medications that we often talk about deprescribing, just even introducing that concept of deprescribing of possibly as psychiatric medications. Again, with Dr. Weiss said that we need buy-in from the patient to think, wow, I didn't have to get on medications for diabetes. I was able to put into remission my own diabetes or reverse it. Maybe I could do that same thing, with my psychiatric medication. So I think really trying to focus on all of those spokes in the wheel, and the fact that he's now disabled from a profession, and then, how does that fit in that he's not teaching anymore, and what's now his sense of purpose, and really trying to tap into some of those other layers.
I have to say, I always learn so much from these, and I'm a radiologist. So, and we're really, we've gone over a little bit, which pretty much always happens. We always run out of time because we have so many interesting conversations and discussions. Does anybody have anything that they desperately need to get out before we start to wrap this up? All right, I'll take that. Yeah, go ahead.
If I could just make one last comment on the lipids, and Dr. McDougall's talked about this for decades, but a part of what we're dealing with is the backlog effect, is that for 60 years, he's eaten chicken and cheese and eggs and butter, and that goes into his adipose tissue as is, those saturated fats. So as he lost 18 pounds, that's 63,000 calories worth of animal fat. He may be a vegan, but he's re-eating what he ate before, and that's coming out into the system. There's also an equilibrium between that additional 30 or 40 pounds that are there that Dr. Weiss mentioned that he still needs to lose, 20 or 30, that needs to work its way down. So I tell people, don't get discouraged. The fact that your sugar may not come down as fast or your lipids may not come down as fast, you're working off what was years of dietary indiscretion. Not your fault. Parents and teachers taught you wrong how to eat, but good news, it's getting out of there and it will get better. Absolutely do not start a statin. They have their own side effects. He's now diabetes reversed. He's kind of in primary prevention. It's not indicated. I know you mean, it's kind of that tendency, oh, he's had diabetes, we got to start it. But at this point, he's doing so well on lifestyle. Keep it up. Thank you for presenting such a great case.
Yeah, thank you so much. And I learned something, the backlog effect. I know Dr. McDougall says the fat you eat is the fat you wear. Here we do have facilitated programs that you can refer your patients to. They're all ACLM certified. We run our own Jumpstart program. We run the LIFT project, and we run CHIP, which is now known as Pivio. I thank everybody and have a wonderful evening. Bye-bye.
Bye, thank you.
Thank you.